Hi there, I'm Dr. Matt Davis. I'm a primary care doctor and the director of the C.S. Mott Children's Hospital National Poll on Children's Health. Our topic this month is secondhand smoke. You know, back 50 years ago, 1 out of every 2 adults in the United States was a cigarette smoker. Today that number is much lower. Just 1 out of every 5 adults is a cigarette smoker. But those adults, whether they're parents, grandparents, aunts and uncles, even neighbors, are still a source of secondhand smoke when it comes to kids. Smoke is a real health hazard for children whose lungs are still developing, and especially for kids who have illnesses like asthma, where the lungs are especially fragile and can flare up when they're exposed to cigarette smoke. Today, 40 states have in place some sort of ban about smoking in public places. And in fact, 6 states have enacted bans on smoking in cars when kids are present. We decided to catch up with the public attitudes about cigarette smoking and secondhand smoke where kids are concerned in our latest C.S. Mott Children's Hospital National Poll on Children's Health. So what we found in our sample of over 2,000 adults in the U.S. is that 87% support the idea of prohibiting smoking in any business where children are allowed. 82% support the idea of banning smoking in cars where children younger than 13 are present. And 75% of adults would favor prohibiting smoking in households where a child has asthma or a similar lung condition. So what we know now from this latest C.S. Mott Children's Hospital National Poll on Children's Health is that there is strong public support for various different ways to reduce children's exposure to secondhand tobacco smoke. For many states, cities, and counties, these would be new regulations, but the level of public support is so high that now may be the time for public health officials and legislators to move forward on those ideas in order to protect children's health.